A new category of intake values has been added to the dietary reference intakes, called the Chronic Disease Risk Reduction Intake, or CDRR. The CDRR does not replace any of the existing DRI categories, but it changes how evidence on relationships between nutrient intake and chronic disease risk is assessed and used in the DRI process. The 2019 update of the Sodium Tolerable Upper Intake Levels, or ULs, is a useful example to demonstrate this concept. When the sodium DRIs were first published in 2005, there wasn't a separate category or process for evaluating evidence on the relationship between nutrient intake and chronic disease risk. Evidence that higher sodium intakes elevate blood pressure, and that elevated blood pressure in turn increases risk of chronic disease, was used as the basis for the sodium UL in 2005. In the 2019 update of the sodium DRIs, evidence of sodium's relationship with blood pressure still played an important role in informing DRI values, just in a new, different category, the CDRR. So what happened to the sodium UL? In the updated sodium DRIs, the scientific evidence reviewed for the sodium UL focused solely on evidence of non-chronic disease adverse effects of high sodium intake, rather than sodium's effect on blood pressure and chronic disease risk. Although there are adverse symptoms at higher and more concentrated intakes of sodium, the evidence was considered to be too limited to establish a sodium UL. The lack of a sodium UL does not mean there's no health risk from excess sodium intake. It just means that the relationship between sodium intake and chronic disease risk is now reflected in the sodium CDRR, and that evidence of adverse effects from high sodium intakes other than chronic disease is too limited to set a UL. Continued research into the range of health effects from high sodium intakes may help to inform future updates of the sodium DRIs.